Hi everyone, my name's Dr. Rachel Corman. I'm the Feline Internal Medicine Specialist at CAT Specialist Services, and this is a short video just to demonstrate what happens when we recommend a CSF tap for your cat. So CSF stands for Cerebrospinal fluid, and it's the test that we use when we obtain a small amount of spinal fluid from cats, and that spinal fluid basically bathes the brain and also bathes the spinal cord. And we use this test to try and identify diseases such as fungal infections or parasitic infections, or diseases such as meningitis or even cancers within the central nervous system as well. So this test is always performed with your cat under anaesthesia, and that's essentially because the cats need to be very, very still. We'll clip a region over either the base of the neck if we're performing what's known as a Cisternal Csf Tap, or we may clip an area of skin over their tail base if we're performing what's called a Lumbar Csf Tap. And there's various different reasons why we may recommend performing a cisternal tap or a lumbar tap, depending on individual patients. What happens is once that region is surgically prepared, we then guide a very small needle through the bones of the spine at the base of the neck into the space where the spinal fluid is. And we generally take a very, very small volume, and that then gets sent off to the laboratory for further testing. So the laboratory may look at the type of cells that are in the spinal fluid, they'll look at protein levels within the spinal fluid, they'll also look for infectious agents, and then there's other more advanced testing techniques that we can use, such as PCR for organisms such as toxoplasmosis and cryptococcal organisms, and for viruses such as coronavirus. Generally, we start to get results through within 24 hours of performing the test in the cats. Potential complications associated with this test, the complication risk is really quite small, but it tends to be a little bit higher in cats that have very severe neurological symptoms affecting their brain. Risks can include things such as trauma to the spinal cord when the needle is inserted, or alternatively, what can happen in some occasions, and again this is a very rare complication, but if we have increased pressure within the brain, if we then remove a small portion of the spinal fluid behind this, then we can get movement of the brain under the bones of the skull, so what is called a brain herniation. And this can be a very severe complication if this occurs. We tend to perform an MRI scan or advanced imaging techniques before we consider doing a spinal tap in ideal circumstances. And one of the things that we're looking for when we perform these studies are signs of raised intracranial pressure. And it may be that we actually ring you and say, look, it would be great if we could perform a spinal tap, but actually we're concerned that the risks might be too high based on the patient's MRI results. Having said that though, that complication is very, very rare. Once we have performed the test, the patient generally recovers very quickly from their anaesthetic, and we will call you as soon as the procedure is completed. So if you have any questions about this procedure, please don't hesitate to reach out to us at any point at CAT Specialist Services, and thanks for your attention.